Doshan! What's up, people of IRC and elsewhere? This is Undefeatable Twilight. I went to the gender clinic again yesterday, and no, I didn't have any train delays this time, which was weird because, well, okay, let me tell you about my weird luck. I tried to get there on time for my appointment. I end up being half an hour late because of train delays. I tried to get to Crossgates, which is just a short bus ride away from the hospital, an hour before my appointment, so I'm there on time. I just barely make it on time because of train delays. Yesterday I tried to get to Crossgates 2 hours before my appointment, which entailed waking up at 7 AM, and everything was on time. What is my life? But it gave me time to go to KFC before I had to go there, so I'm happy anyway. But anyways, yes. Voice coaching, that is what I was doing. Well, not really. It was just an introductory session, so we didn't really do much except talk and get to know each other. I had to go like up, down, because I got there and I saw that I had an appointment, and I gave them the appointment letter, and they said, okay, go to the waiting room upstairs. So I went up there. It was still about an hour to go before my appointment, so I went up there, waited for a bit, playing, well, rather watching the cutscenes of Kingdom Hearts 3D on my 2DS, until someone came and asked, I can't remember what they asked me now. They asked that I use some other name that isn't my name, and I said no. No, are you waiting for someone else? And I don't remember. But basically, someone came, found out I wasn't one that they were supposed to be seeing, went away, and then a bunch of other stuff happened, and then someone else came to me, said I had to go to the waiting room down. A person came to me, asked, "Are you whoever?" I can't remember now, and I said no. And they determined that I was waiting for the voice coaching, and so they said that apparently the receptionist had gotten confused and told her that I was there to see her because she's a speech therapist, but she does one-on-one sessions, and I was there for a group voice coaching session. So she went downstairs, explained to the receptionist, so then they told me to wait in the waiting room downstairs. I went in there, sat there for a while, and then someone else came back, told me to go back up. The receptionist actually told me to go back upstairs. So I went back to the waiting room upstairs, and then finally the right person, a lot of other people showed up, and then finally the right person came out, and we had the session. And it was great. Like I said, we didn't do much because we were just like getting to know each other and stuff. But it sounds interesting. It sounds kind of hard. There's a lot of theory stuff practical stuff that I haven't really gotten the hang of yet. There's we talked a lot about resonance. If you're not familiar with this, basically the difference between male and female voices is more to do with where the voice is resonating in your body rather than the actual pitch or whatever. So like deep voices will resonate in your chest, whereas they can also resonate like in the back of your throat or in the sinuses or wherever, like wherever there's space in your body, basically. But I'm kind of having a hard time like getting the hang of controlling the resonance, but I guess I'll learn. It's only the start. They gave me some reading material, so I thought I'd share this with you. This is advice for care of the voice. So this, if you are transgender yourself, this might be useful to you, and if not, it might still be interesting. Who knows? It's definitely be useful to me. I haven't read this yet, so some helpful hints for the care of the voice. Like side, yes, good. Hydration. The vocal folds that we used to call them vocal cords, but nowadays the more proper term use is vocal folds because they're not really cords; they're like just folds. Actually, yeah, that's the point. She told me to Google image vocal folds. I still haven't done that. I'll do that in a bit. Yes, but the vocal folds need to be lubricated with a thin layer of mucus in order to vibrate efficiently. The best lubrication can be achieved by drinking plenty of water, or any other drink. I don't drink water because I don't like the taste. A good rule of thumb, if you have normal kidneys and heart function, is to drink at least 2 quarts of water daily. Dr. Van Lawrence, world-renowned laryngologist, often said, "Drink until you pee pale." So basically, yeah, that's what it implies. Caffeine and alcohol pull water out of your system and deplete the vocal folds of needed lubrication. Caffeinated drinks include coffee, tea, and soft drinks. Some soft drinks, not all of them, have caffeine in. I drink Fanta Fruit Twist Zero, and that doesn't have any caffeine in. I've checked the label. Small amounts of these beverages are acceptable, but must be counterbalanced by drinking more water. But if I have to get used to drinking water, the water in Lancaster tastes awful, like tap water. I get bottled water, I guess. That might not be so bad. But tap water, no, I don't want it. Throat clearing and harsh coughing. Throat clearing and harsh coughing are traumatic to the vocal cords and should be reduced, it says cords here, and should be reduced as much as possible. One of the most frequent causes for throat clearing and coughing is thick mucus due to dry vocal folds, or too much mucus, as with a cold, on or below the vocal folds. The safest and most efficient way to clear mucus is by using a gentle, breathy, productive cough where there is high airflow with little sound. This can be achieved by using the following strategy. Take in as deep a breath as possible, momentarily hold your breath, and produce a sharp silent H sound while you expel the air. So they go like that, I guess. I don't know. I haven't got a hang of that yet. Drugs. Antihistamines. Antihistamines are sometimes prescribed to treat allergies and are present in some over-the-counter cold medications. Antihistamines should rarely be used because they tend to cause dryness. Well, I don't use them anyway, so that's fine. Reflux disease and recommendations to prevent acid reflux. I have a problem with acid reflux, honestly. Not all the time, but sometimes. What is reflux? When we eat something, the food reaches the stomach by travelling down a muscular tube called the esophagus. Once food reaches the stomach adds acid and pepsin, a digestive enzyme, so that the food can be digested. The esophagus has two sphincters, bands of muscle fibres that close off the tube, to help keep the contents of the stomach where they belong. One sphincter is at the top of the esophagus at the junction with the upper throat, and one is at the bottom of the esophagus at the junction with the stomach. The term reflux means a backward or return flow, and refers to the backward flow of stomach contents up through the sphincters and into the esophagus or throat. What are GERD and LPRD? Some people have an abnormal amount of reflux of stomach acid that goes up through the lower sphincter and into the esophagus. This is referred to as GERD, or gastroesophageal reflux disease. If the reflux makes it all the way up through the upper sphincter and into the back of the throat, it is called LPRD, or laryngopharyngeal reflux disease. The structures in the throat, pharynx, larynx, vocal folds, and the lungs are extremely sensitive to stomach acid, so smaller amounts of reflux into these areas can result in much more damage. Why don't I have heartburn or stomach problems? This is a question that is often asked by patients with LPRD. The fact is that very few patients with LPRD experience significant heartburn. Heartburn occurs when the tissue in the esophagus becomes irritated. Most of the reflux events that can damage the throat happen without the patient ever knowing that they are occurring. Common symptoms of LPRD: hoarseness, chronic ongoing cough, frequent throat clearing, I might have it then, pain or sensation in throat, feeling of lump in throat, problems while swallowing, bad or bitter taste in mouth, especially in the morning, asthma-like symptoms, referred ear pain, post-nasal drip, singing difficulties, especially with high notes. Medications for LPRD. There are acid pump inhibitors to control the amount of acid in the stomach, but there are sometimes long-term side effects with these. Diet can help enormously. If you Google diet for LPR, you'll find a lot of information. Smoking makes reflux worse. Well, I don't smoke, so that's fine. Requirements for a healthy voice. Try your best to maintain good general health. Get adequate rest to minimise fatigue. I try to go to bed regularly. Exercise regularly. I go walking every day. Eat a balanced diet, including vegetables, fruit and whole grains. I do. Maintain body hydration. Drink 2 quarts of water daily. Okay, I have to start getting water then. Avoid dry, artificial interior climates and breathing smoggy, polluted air. I do, as much as possible. Avoid throat clearing and voiced coughing. I try. I do clear my throat a lot, it's a problem. Reduce demands on your voice, don't do all the talking. Yeah, that's a problem with me as well. Learn to breathe silently to activate your breath support muscles and reduce neck tension. Take full advantage of the 2 free elements of vocal fold healing, water and air. Optimal speaking techniques. Use good abdominal diaphragmatic breathing and support. Learn to use your voice with as little unnecessary effort and tension as possible. Take frequent breaths when speaking long sentences. Allow the neck, jaw and face to be relaxed. That's basically it. So I have a lot to learn, but hopefully I will learn it. But it's a 9-week course. The first week starts in January, and then it's every Thursday after that, so for 9 weeks. So by the end of it, hopefully I'll be speaking like a real girl. These are some statements from other people who have used the course, other feedback from trans women who attended 8-week voice course. I truly detested my voice. I was very wary about meeting new people. As the 8 weeks have gone on, my confidence has been building and I am using my new voice more and more. It was a lot more comfortable working in a group than I had imagined. It was fun as well as educating. You had the patience to deal with different learning levels. It was good being in a group, knowing that other people had similar problems and learning from them as well on the journey. Well worth the effort to attend all sessions and gain a lot of knowledge in a daunting field. Presentation was absolutely magnificent. Involvement was kept to an absolute maximum at all times. I have never been a group person, but working in the group gave me lots of confidence and was a great basis for finding where my voice was. I had no confidence at all about using my voice. Attending the group has given me the confidence to try. The best thing was finding a range in my voice I never knew I had. The exercises, which were daunting to begin with, have turned out to be fruitful. How much I've enjoyed the last 8 weeks and how beneficial the sessions have been. What has been disappointing? Coming to the end. I feel much more confident of being able to modulate and project my voice so as to be able to converse normally and even to speak to an audience with a voice which sounds acceptable for a woman. The sessions I've had with Maggie, that's the therapist I'm seeing, have been immensely valuable. She swiftly enabled me to find a voice that I am much more comfortable with, through practical demonstrations, technical exercises and acute listening to each other, all done with huge generosity of spirit, discipline, depth, challenge and tremendous focus. In short, Maggie's work is outstanding, highly skilled, effective and beautifully tuned and tailored to the needs of her clients. Lindsay Weir, Senior Lecturer, Drama Education, Bishop Grosseteste University. So that's it. So apparently a lot of positive feedback. We'll just have to wait and see how it goes. Come on, Notice. You really are getting in the way a lot lately, aren't you? She's been needy lately. I think she knows I'm going to be going away soon. Anyways, yes. So 8 weeks plus 1 introductory session, so 9 weeks really. Every Thursday, starting in January, I'll keep you posted, give you regular updates, and I guess Nisus will be here too, really. So, thanks for watching. Remember to like, comment, share, and subscribe. If you are subscribed, be sure to ding that notification bell so you know when I make a new video, because I can make it whenever I feel like it, and there will be plenty more coming. Thanks to my patron Angel. If you want me to read a story that you have written, then I will do that if you support me on Patreon. There are different reward tiers that you can check out, and you can also check out Angel's Amazon page, because he writes books. And also, if you are transgender, whether male or female, and you have had voice coaching difficulties, you know, or whatever, just any stories to tell me, feel free to put them in the comments, because I'm interested. I like to hear about how other people have found this kind of thing. So it's all new to me, and I'm not doing it alone. I know in the group, because it's a group session, so there are other people with me. But yeah, I like to hear other people's experiences. So feel free to put them in the comments if you like, or if you know someone else who is transgender and know how it's been for them. But thanks. I'll see you next time. Take care. Love and peace.